So, what is the long-term follow-up process for HS? Is there an ideal kind of stability range that people get to? Is there what's the ideal outcome for treatment?
So ideally, we want to decrease the progression of the disease. We want to manage the burden of symptoms. And we also want to decrease the amount of flares that patients get. So those are the three things that I look at when I'm starting a patient on treatment. And typically see patients back in 3 months because on average that's how long it takes to see improvement, especially with immunomodulators and biologics. So every 3 months, I'm seeing patients until they're well controlled, and after that, we can space out the visits a little further. But it's important to continue to follow these patients, especially because of the high risk of comorbidities that they have.
Where do you see some of the gaps in the healthcare system as far as, it can be from diagnosis to treatment to maybe even research?
All three. So it takes on average 7 to 10 years for patients to get diagnosed. Um, Treatment wise, we still have a long way to go, but it's exciting. There's a lot of new and exciting research that's being done on targeted therapies. And then for research, again, it's very exciting. In the last decade, there's been an explosion of HS research and publications. But there's still a lot that we don't know about the disease, and we need to catch up with diseases like psoriasis that have a lot of FDA approved treatments. And for HS, we only have three FDA approved treatments.
And then, what is the landscape of clinical trials, for example, and where do you think the gaps are with the clinical trials process? I know typically for even research in general, um, there's not a lot of data on certain populations. Like there's not a lot of data for Black people in
Yeah.
general. So how does that impact just the clinical trial process? Where are the gaps in the data?
So we know that clinical trials lack representation of minority, groups. And it is something that I believe the pharmaceutical companies are working hard to correct. So for instance, at the University of Chicago, being located in the South Side, I tend to see a lot of Black patients, and I've approached the pharmaceutical companies as to why these clinical trials were not conducted at places like University of Chicago, and so that's changing. So hopefully, we should be seeing more clinical trials in the future.